In business statistics, today we are going to pick up a question called when to use Laney P chart or Laney U chart and what factor to consider. Before that, let's understand what is control chart. Control chart, as you know, control chart helps to identify the common cause variation, which is very natural cause, or a special cause variation, which is assignable cause. By identifying the different causes of variation, you can take an action, right? If the patient is healthy, no medicine is required. If the patient is not healthy, the medicine is required. Just like this. So it helps to identify whether the common cause present or a special cause present. So the simple definition over here, let's say this is a common center line, that is the average, and then lower control limit and upper control limit. The value should be well within the limit. If value well within the limit, we call it as common cause variation. There is no special cause. If the value go out of the limit, whether it is lower control or upper control, we say outlier. In other words, is called special cause variation, which requires an action to take after investigation. And this is a simple example. So you see the process is good until Jan to September, and all are variation due to natural causes. Suddenly in October, November, December, we have an outlier. We call it as variation due to assignable cause. That we need to investigate. It is called out of control, outlier, everything. Right? This is called natural cause or a special cause. So there are 7 type of control chart, and we are specifically talking about the Laney chart, which comes in defect family, and defect and defective family. P chart comes under defective family, and defect family is U chart. The same, we have an additional chart called Laney P chart and Laney U chart. And this is the tradition chart, P chart and U chart, and Laney is the additional chart, right? So when to use it? So here is the answer. So Laney chart you can find from that control in the mini tab, stat control chart, attribute chart, Laney chart. Laney chart is similar to tradition chart. It does 2 things. It find out if it is any overdispersion, like if your subgroup exhibit a lot of overdispersion or underdispersion, it helps to correct that one. The calculation of the Laney P chart includes a sigma also, sigma z, which is adjustment over dispersion or underdispersion. A sigma z value 1 is indicating that there is no adjustment is being made. If it is exactly in the if the value is 1, there is no adjustment is being made. If the Laney chart exactly on the same tradition P chart. If the value differs, then it shows that it has some correction. So this is what you can go. You can go to stat, control chart, attribute chart, P chart 1. This helps to identify whether you can go for P chart, that is tradition chart, or Laney P chart. So our same way we can do for U chart also. You can go to U chart and Laney U chart diagnostic. The diagnostic will help to diagnose whether we can use the tradition or the normal one. With that, we can easily find it out. So why it is so big deal? This is the reason. For example, let's say I have done the P chart and it shows that there is an outlier. The same data I've done that LaneyPChart. It shows that it has only common cause. There is no special cause in it. So choosing the right chart is very, very important. I hope this video is useful.